What you had said about children tend to be less affected in terms of being reported as cases, that is true, representing between 1 and 3%, in some countries up to 5% of the reported cases to WHO. There are some seroprevalence studies that are being conducted that are looking at antibody response in children, and there are a few studies that are coming out now. Again, they're not all peer-reviewed publications, but some of those are preprint. And what we're seeing from them is that children do seem to be, we need to break down what children mean. The youngest children under 10 years old, for example, versus children over 10. And it depends on how the study broke down age. Some of them range from 5 to 9, some of them range from 10 to 14. But what we're seeing is that children in the youngest age groups have a lower seroprevalence, and those that are above 10 seem to have a similar seroprevalence to those that are among older young adults and above 20 years old, which means that they can be infected, which we've said from the beginning, but they do tend to have more mild disease. In terms of transmission, there's quite a lot that we still need to understand about transmission in children. Many of the schools and many of the countries that imposed these public health and social measures, or so-called lockdown measures, did include closing of schools, although not all did. And we're learning from some countries, as they're opening up some of those restrictions. We have heard of some outbreaks in schools, mainly among the older children. But again, there's a lot that we don't know about transmission among children. With regards to schools and advice on schools, WHO has issued guidance on the safe running of schools and making sure that certain measures are in place. We've also issued guidance on when schools considerations of when schools can reopen, and that takes into account a lot of different factors that decision makers need to take, whether it relates to the transmission that is occurring in the local area or the catchment area of the schools, the type of school structure it has, the ability for the school to have these to be able to implement the measures like physical distancing, hand washing, etc. And so there's a number of considerations that need to take place. But as you highlighted, children do seem to be less affected, but they can be infected. And that is important. Our understanding of transmission in children is still limited, and we know that overall they tend to have more mild disease, but in some situations they can have severe disease, and we have seen children that have died.
Yes, and thank you, Maria. I think that says it all. I think we've been around, if we cast our minds back over the last couple of months, we've had healthy debates and around everything from long-term care facilities to transmission in dormitories, to transmissions in airplanes, to transmission on public transport, healthcare settings, the workplace, and now schools. And Maria is absolutely correct in that we don't fully understand the full contribution of children to the overall epidemic. The fact remains that when community transmission exists, and when community transmission is intense, children will be exposed to that virus, and children will be part of the transmission cycle. They will be exposed, some will be infected, and they may infect others. What we don't fully understand is the impact on those children in the long term. We know in the short term they tend to have milder infections. We don't know the impact in the long term, and we don't know to what extent they pass that infection on and infect others. But we do know that that can happen. So when we look at that, and we can have the same issues when it comes to the workplace, and we talk about employees in the workplace, or we talk about long-term care facilities and health workers in the facilities and older people and visitors, and to what extent do visitors bring the disease in, or to what extent do health workers participate in transmission. And all of this is in the setting of what's happening in the community. And in communities where transmission has been effectively suppressed, where countries have been successful in driving down transmission of the disease across the board, then you reach a point where everything is safer. The problem we have in some countries right now is that it's very difficult to determine the safety of any environment, because there is just so much transmission going on that all potential environments in which people mix are essentially problematic. And that's a problem. We've all paid a heavy price. Countries around the world have gone into very serious movement restrictions, stay-at-home orders, in order to suppress the virus transmission. And as countries have opened up, In some countries, the suppression of the virus has been kept in place. Countries have opened up carefully, sequentially, in a stepwise fashion, and have strengthened their public health architecture and have strengthened their capacity to investigate clusters and suppress the disease, and in some cases implement subnational or targeted measures at movement restriction or stay-at-home orders. And in that case, schools are part of that. So yes, there is an issue around how much and to what extent children participate in transmission. There are real issues around how schools can be reopened safely, but the best and safest way to reopen schools is in the context of low community transmission that has been effectively suppressed by a broad-based, comprehensive strategy. We can't move from let's deal with the schools and then we all deal with that for a week or two and then let's deal with the workplace or then let's deal with infection in hospitals or long-term care facilities. This is playing whack-a-mole. We have got to focus on a comprehensive, long-term strategy that focuses on everything at one time. We've got to chew gum and walk at the same time, and we keep pulling ourselves down various rabbit holes. Schools are a hugely important part of this. They're a hugely important part of our social, educational architecture. They're the baseline of our civilization. But we can't turn schools into yet another political football in this game. It's not fair on our children. So we have to look at this carefully, in the light of the transmission in any given country or any given setting, and we have to make decisions that are based on the best interests of our children, be it their educational or their health interest. And that must be based on data. That must be based on understanding the risks in the specific setting in which schools are. What is the community transmission and what are those risks? And my fear in this is that we create these political footballs that get kicked around the place. And it's for me, we need to get back to what the Director General has just spoken about. Comprehensive strategies, sustained commitment to broad-based virus suppression. If we suppress the virus in our society, in our communities, then our schools can open safely. And there are many countries around the world in which schools are reopening successfully and safely, because countries have dealt with the real problem, community transmission. So I would advise us all to look carefully at schools. We will continue to, I think we have a technical advisory group meeting coming up, Maria, and we want to speak to that. We're bringing experts together from all over the world once more to look at how we manage and open schools in a safe and effective way. But please, let us not turn this into yet another political football.